My name is Brooke Briggance, and I'm the Program Director of the Cypress Resilience Project at Public Health Institute, a partner of Tracing Health.
So my role at Tracing Health is as a partner, and I am the Program Director of Cypress Resilience Project, which is also a program at Public Health Institute. And we were brought in really early in Tracing Health's existence to address some of the issues that contact tracers were facing when they were calling clients. So contact tracers, case investigators, care coordinators were interacting with people sometimes at the very worst time in their lives. And they needed to know how to handle things like grief or maybe someone managing depression. And so we started to partner with Tracing Health to make sure that the workforce had the skills that it needed to really address people who were managing really high levels of stress during the pandemic. And what we learned was that, the workforce needed support too. And so it was so exciting because then we were able to offer other types of training. So managing their own toxic stress, thinking about the neuroscience of self-care and how they were going to get through in a caring profession during a really critical time. Part of what we loved about the Tracing Health program was that there was a focus on diversity, and there was a focus on hiring from industries that had been devastated by the pandemic and economic realities related to that, hiring people from really diverse communities, multilingual, multicultural people. And, that meant that they were managing a lot of their own stuff too. And so every time that we got into a training, we would be really doing two things. One was thinking about their role in Tracing Health and how they could support clients, and it had the secondary impact of really supporting them. And so we've built what I like to think of as a learning community. One of the things that we learned in our partnership with Tracing Health at Public Health Institute was that contact tracers, case investigators, care coordinators, people who were interacting with the public, they were very often faced with situations where they didn't really know what to say and what to do when confronted with a client on the other end of that line who may be grieving the loss of a spouse, or maybe they just lost their job, or maybe they were being pressured by their employer to get back to work even if they had a positive diagnosis, but they were scared of doing that. And so there are all these amazing people in Tracing Health who are out, on the front lines fighting the pandemic, trying to work with the public, and yet every once in a while there would be these situations where they needed more skills in how to address a mental health challenge or maybe grief or trauma on the other end of that line.
The most important part of my job is creating safe space for sensitive conversations. It's all about ensuring that everyone walks away from a training feeling hopeful and empowered.